As somebody who's been a skateboarder for more than half my life, I know a little something about pain. Let's get into it. What's up everyone, Mike Muellner here, and today we're going to talk about pain, or more specifically, how do we quantify pain? So it's really important for patients to be able to tell their doctors and nurses how much pain they're experiencing. This can determine not only diagnosis. For example, a doctor is more likely to chase after certain diagnoses like a fracture if there's a lot of pain involved. But it also determines what sort of medications you might receive. If you say, oh, I'm just in a little bit of pain, maybe the doctor will just give you some Tylenol, if this is in a hospital setting, for example. But if the pain is really severe, let's say it's pain from pancreatitis or pain from a heart attack or cancer-related pain, then the doctor is more likely to give you stronger pain medication. So being able to accurately quantify exactly how much pain you're experiencing is really important. With that being said, how do we even do it? I mean, what is severe pain versus middle of the road moderate pain? Who knows, right? Well, here's a chart that can help. This is the Wong-Baker-FaCES pain scale. If you've ever spent any time in a hospital or a clinic, you've probably been familiar with this. So what this does is there's a bunch of different faces that range from just looking like a little bit of distress to more severe discomfort to just excruciating pain. And so this chart is given to patients who will then look at this and say, you know, where on this chart do I fall? Is the pain that I'm experiencing really, really bad? Do I look like this face here on the far end of it that is in obvious, really severe pain? Or do I feel more or less okay? I'm kind of middle of the road. And so the FaCES pain scale helps patients to be able to quantify exactly how much pain they're experiencing. In general, we rate pain on a scale of 1 to 10. So pain that's 1 to 3, that's considered mild pain, and that's pain that you can definitely feel it, but it doesn't really interfere with your day-to-day activities, and for the most part, you can ignore it. Now, pain that's 4 to 6, we consider this to be moderate pain. And so this is pain that's more significant, and maybe you might be able to tough it out, make it to the end of your work shift. For example, if you have a headache, that's a 4 on the scale of 10. But it's going to be uncomfortable, and you probably wouldn't be able to, for example, enjoy going to the movies if you had a headache that was at that degree of intensity. Contrast this with severe pain. So severe pain, we consider this to be 8, 9, or 10. This is pain that's so bad you almost can't think of anything else. And with this level of discomfort, it's something that really needs to be treated right away. So for example, if you're in the emergency department, maybe you've had a hip fracture or something that's really painful, 10 out of 10 pain, the doctor is probably not even going to mess around with pills. You're likely to get an IV pain medication that acts right away. Now, with all that said, it can still be a challenge to quantify pain in a standardized way because everybody experiences it differently. But the FaCES pain scale can help to get everyone on the same page, and you might, think that you're having 10 out of 10 excruciating pain, but then you look at the scale and realize, oh, maybe it's more like a 6. I can still tolerate it, but it's pretty uncomfortable. Okay, now for a funny story. Back when I was in medical school, I was first introduced to the Wong-Baker-FaCES pain scale, and I thought that the scale was for me to use as the clinician. So I would actually hold up all the little faces, and I would try to compare my patient's face to what I saw on the page, and I would think, oh, this person, they seem kind of uncomfortable. That looks about like a 5. It looks like a 5 to me. But I mean, that's completely ridiculous because you look at the cartoon faces, right? These barely even resemble a real human being. So I had it backwards. It's not for the clinician, it's for the patient. And it was actually first designed to be used in the pediatric population for kids. That's probably why they have such silly cartoon-looking faces, but you can use it for adults as well. It's just a way to help get everyone on the same page to understand how to quantify the pain and discomfort that they're experiencing. All right, I hope this video was helpful in helping you understand how to quantify pain in the healthcare setting. Here's a link to another video right here. If you like this content, go ahead and hit the subscribe button, and I'll see you guys next time.